Okay, so now we're going to be doing our medication administration on our newborn baby. First and foremost, I am going to go do my 3 safety checks, which I know I'm always going to check my patient identification against my MAR. I'm going to check my patient against my patient's my MAR against my doctor's orders, and then I would do my safety checks. So I would perform my safety checks at the Pyxis, at the bedside, and then before pulling it out of the drawer. Okay? And then I would always perform my 10 rights of medication administration prior to. So typically before you administer a medication to a patient, you're going to go out of order. So you would obviously educate your patient on what the medications are going to be for. And I would give this education obviously to the mom. I wouldn't be giving it to an infant. So I would educate the mom on what my erythromycin is for. It's an eye ointment for the baby's eyes, and then I will also educate them on what the vitamin K is for, and that it helps the clotting mechanism in babies because their liver is not fully developed, and just in case they have a disorder or a complication and they begin to bleed out, it helps the clotting in babies. So I would give my patient the right to education, and at this moment she would also have the right to refuse. My mommy's not refusing, so I'm going to continue on with my other rights. So I would do my right assessment. I'm going to go in order in a minute. And then after I do my assessment, after the administration, I would do my documentation and then my evaluation again. Okay? But prior to that, I'm going to make sure I have the right patient. I'm going to make sure I have the right route, of which this is going to be IM. I'm going to have the right drug, which is super, super important. Right dosage and the right time. And then all of my other rights that I just named. So right route, right patient, right drug, right time. Right route, patient, drug, time, right dosage. The right to education, right to refuse, right documentation, right assessment, and right evaluation. My 10 rights of medication administration. So now I'm going to go ahead and I'm going to get my MAR. Which I left in my room. So I've got my MAR, I've got my doctor's orders. So I'm going to go ahead and make sure my doctor's orders match, make sure I match the patient identification. I'm at my Pyxis. I'm going to perform another safety check right here, making sure I got the right medication against my MAR and my doctor's orders. This is my erythromycin eye ointment, and this is I'm going to use that as a blooper for my graduation video. And this is going to be my vitamin K. So I'm going to pull that out of my Pyxis. And again, I performed another safety check. My last safety check would be done at the bedside with my patient. Okay, so the eye ointment is going to be given as soon as babies are delivered. So I'm going to go from the inner canthus to the outer canthus. I'm going in my patient's room, going to wash my hands, perform my kiwis, put my gloves on, and then I'm going to go ahead and perform my last safety check. I'm going to perform my last safety check here. The bedside, I've got the right drugs, right route, right dose, right time, right patient. Check my patient's identification bracelet, and this is the correct patient. So now I'm going to take my eye ointment, I'm going to open it, and I'm going to administer from the inner canthus to the outer canthus. From the inner canthus to the outer canthus. And if there's some excess, I would just wipe it away, making sure it's not running down the baby's face. That is that. Now, with my IM injection, I'm going to go ahead, and I did not grab my, darn it, I didn't grab the, oh, I do. I'm going to clean off the top with my alcohol. I'm going to check the expiration date. It's fine. I'm going to grab my needle. I'm going to go ahead and we'll say it's at about, we'll just pull up this much. We didn't get any orders for how much we should be pulling up, so I'm just going to pull up something like that. Okay. Oops. I need to push the air in there first. Let me flip it. Okay. Now that we've got that, I'm just going to use the one-hand method and just cap it really quickly while I prepare my patient here. Okay, so I'm going to go ahead and give it in the little baby's thigh right here. Okay. Okay. So I'm gonna go ahead, use my alcohol. I'm gonna do my Z-Track method. And little baby's gonna cry. Performing my Z-Track. I would never do this with a needle. I need my baby's hand out of the way. Okay, I'm gonna perform my Z-Track method. I've used my alcohol there. So I'm gonna 1, 2, 3, insert. Gonna aspirate and then inject. Hold for 10 seconds, pull out, and then I would cap it back. And that's it for my little baby. My baby's got their vitamin K. And that's it for my medication administration. Thank you. And then I would perform the rest of my 10 rights of medication administration. So I would come back and assess my patient, evaluate my patient, document my patient's everything that I just gave to them. Thank you.